In 1893, Lillian Wald, a public health nurse and social reformer, set up a clinic and settlement house called the Henry Street Settlement in the Lower East Side of Manhattan. Her patients were the sick and impoverished immigrant families getting off ships at Ellis Island. Wald deployed nurses into the home to care for those who did not come to the clinic, establishing the first home health agency, known today as the Visiting Nurse Association, or VNA. Wald's mission was simple, and it still proves true today: provide quality health care where it matters most, in the patient's home. This is what Children's Mercy Home Care does on a daily basis.
I loved working in the NICU. We followed these babies for so long through so many things, and then we just kind of released them and hoped that, everything turned out okay. So to be able to follow them once they're home really appealed to me. There's what you set up for to be a typical day. Whether or not it always works out is a completely different story. We typically have 3 to 4 patients a day. If you can touch base back at the office at some point during the day, I try to between visits. Otherwise, I kind of chart in my car as I go along. The work that you're doing is important because you're in the home, but that comes with challenges such as you don't have staff nearby to help you. You don't have doctors readily available to assist. That's the big challenge, is that you just don't have access to resources right there at your fingertips like you do in a hospital. You also don't have the equipment that you would have in the hospital.
Can I just listen to you, please?
We use our stethoscopes. We rely on our eyes and our ears. You have to always be thinking ahead of what might I need by the end of the day that I don't have in my car. Dosing for babies depends on their weight. There are a lot of challenges. You don't know who's going to be at the house when you get there. You don't know what kind of living situation you're going to walk into. You have to go out. There are certain kids that need you regardless of whether or not it's snowing or raining. So you have to be prepared for that also. I'm very thankful I have 4-wheel drive.
My job is to deliver formula and supplies to the patients and pick up any equipment that we need to bring back. I'm pulling formula for our patients. This patient needs EleCare Jr. The most challenging part of the job, I would think, is making sure that the patients get the right supplies at the right time. Sometimes you're under time constraints. My office is actually my van, so I'm actually taking this out to the office now. I would say 10 to 11 deliveries a day. The most rewarding part of this job is to actually, make a difference with the patients and their parents. What we do, to me, is really important as far as like with the families. If the weather's bad or if we have situations, if we can't get the supplies to them, we can make adjustments like meet them at a central location. If a parent needs something, once they hear that call from me, they know I'm 10 minutes away.
A typical day is that I will have anywhere between maybe 2 to 4 or 5 kids. I can drive anywhere between 40 miles if everybody's close together, up to maybe 75 miles. Rain, snow, sleet. Take these in. Lots of challenges. There's social situations that are definitely difficult to handle. You just have to try to create an environment that will be therapeutic for a child.
Wow.
Think on the fly and you roll with things.
En la palota? No.
Being shy today. Yes. She was very shy around the camera and around other people. So you think about taking her to a clinic full of people and other kids, and I don't think she'd do anything. It is so much better to work, especially with little feeders in the home. It's a privilege if you can make even a little bitty difference, or if you can start seeing a little bit of change, making things a little easier for mom, maybe making things a little bit easier for the baby. I have a heart for kids. Love kids. I never really realize always the impact you make. You can't know that.
Please support Children's Mercy Home Care in our efforts to build upon the legacy of Lillian Wald and to embrace what the new Affordable Care Act entails, preventative health care, because Every child deserves the right to heal at home.